Hello, my name is Wendy Jamieson and I'm the Senior Manager of the Quality Improvement Academy at the New South Wales Clinical Excellence Commission. We're conducting a series of interviews to hear from some New South Wales health staff regarding their experiences of leadership, in particular through the COVID-19 pandemic. Today I'm interviewing Diana Williamson. Diana is a Senior Consultant at the Organisational Development and Learning Unit of the New England Local Health District. Diana's primary responsibility is facilitating the clinical leadership program for the district. Their background is a critical care nurse, in which where she's worked in management, education and consultancy at both the district and at the state level. She's also a conjoint lecturer with the University of Newcastle. So the key point of this interview is to hear about real-world experience.
Hi Wendy, thank you for giving me the opportunity to speak.
Thanks, Diana. And I understand that you were redeployed to the public health unit when the COVID-19 pandemic arrived. So how did you feel in this instance?
Wow, so we commenced the Hunter New England program in February with all the enthusiasm that went with it, and then COVID-19 invaded our world. So program participants became involved and actively involved in pandemic planning for their own services. So as much as the clinical leadership program was important work, it was clearly not a priority in the current environment. So we actually suspended the program in the interim. So I was redeployed to the public health unit as a contact tracer in what was to be the highest activity in the unit to date, and it had all the new technology and databases to navigate. So what this role was, it entailed interviewing confirmed cases and close contacts. We had daily follow-ups with patients and releasing patients from isolation, as well as manning the phones. We were providing information to health services, medical officers, pharmacists, as well as the general public, with information that was actually changing on a daily basis. So there's a series of national guidelines, affectionately known as the Song. That was what became our rule book. What I came to realise is how important this work was in not only protecting the community, but directly supporting the COVID-positive patients. Within a week, I was recruited as a pod leader, which I accepted optimistically, with absolutely no expertise in the area of population health. So I had to really reflect and go, courage is an excellent leadership trait with a little touch of naivety.
Thanks, Diana. So how did leadership look for you?
So each shift commenced with the operations lead handover meeting, in which we had population health experts and managers. We were watching, learning and absorbing the new information and legislation and understanding what the expectations were of the team that I was to lead that day and how the workflow objectives of the day will unfold. So leadership is knowing who your supports are, and the op teams were able to action and escalate information appropriately through a very organised chain of command. An important relationship factor to support any leadership role is remembering to surround yourself with the good people and cultivate that influence whilst managing up when needed. So each day I was given new staff to work with from multiple disciplines. They had different experiences and seniority. No one had expertise in this area. Everyone was a clinician, and we had admin support around that. So that was a really, really great bunch of people to work with. So building rapport quickly and effectively in minimal time was essential to understand the capabilities available in working in this autonomous environment, which was foreign to most of us. As a leader, flexibility and adaptability were key, and keeping the calm was essential. As not everyone thrives on change, some will actually falter. So contextualising this with direct patient contact and above all that chaos that comes with the uncertainty. Ensuring wellness of the team was ever present. Introductions were essential for most days with the different staff allocated. So expectations were clarified with an environment of not one person knows everything, but together we did actually know the most, and that was what we adopted. Consultation was encouraged, and there was always a really positive environment within the pods, which was a really nice place to work, despite all the stress and all the activity that went with it. So allocating cases and workload appropriately as a leader was an important task to ensure that the patients that we actually serviced every day received the best experience and expertise with a staff cohort who were working in that unfamiliar environment. So challenge with support will always bring out the best in people and allow them to do what they just do best, and I guess that's to care. So at times when we reached our capacity to resolve these issues in the ops team and the public health physicians were always on hand to support the pods.
Thanks, Diana. So how might we change our approach to leadership during a crisis?
So what I learned was during a crisis, effective responses are largely improvised and defined by uncertainty and adjustments, and they're made on a daily basis. As activity surges, working with a team to foster collaboration and sharing novel information is an essential approach. Being transparent and distributing authority shows trust in the team to get that work done. So understanding and acknowledging the individual's personal and professional challenges amid a crisis, demonstrating empathy and paying close attention if people are struggling and taking measures to support them. Finally, being aware leaders are required to process information quickly, remain level-headed and apply good decision-making in an environment of uncertainty. It may cause stress and fatigue, so building your resilience and build your relationships early.
Great, thanks, Diana. What's one key thing that a leader can do every day?
So what I would say is like letting go of things you can't control and with working with what you can, being aware of your own reactions and energy, and if you can't be anything else, be human and be kind.
That's really good advice. Thanks, Diana. And thank you very much for your honesty and your very informative reflection on your leadership experience during COVID-19 pandemic. I hope others can learn from you. Thank you very much.
Thank you, Wendy.